Magandang hapon po sa inyong lahat. Muli po tayo nagbabalik para sa isang kapihan. Ako po si Nini Cesario, isang Juan na mula sa Kagawaran ng Kalusugan at ako po ang magiging moderator para sa ating kapihan ngayong araw. Bago po ninyo makilala ang ating kasamang expert, narito po muna ang ating mga house rules. Slide please. Okay, number 1, use the naming convention para po sa ating Zoom usernames to ensure proper acknowledgement. And number 2, pay attention to the discussion of our health experts and resource persons. Number 3, keep your microphones muted while speakers are discussing and presenting. Next slide, please. And number 4, kung may mga katanungan po kayo, maaari pong magtanong sa ating chat box at kung maaari lamang po ng ating mga katanungan ay nakastick lamang po sa topic na i-discuss ng ating speaker. Ayan. At bilang hindi na rin po natin patatagalin pa, narito na po ang ating speaker. At bilang kapipirma lamang ng Joint Administrative Order kasamang iba pang mga national agencies para sa promotion of safe and sustainable open spaces, we have with us today Dr. Miguel Mantarding, the Chief of the Program Management and Capacity Development Division of the Health Promotions Bureau of the Department of Health. Doc Migo leads the implementation of healthy communities and healthy schools. All of this are in fulfillment of his personal mission of improving the health of the underserved. Good afternoon, Doc Migo.
Hello, good afternoon, Nikki. Good afternoon po to all of our media partners. Thank you for joining us.
Ayan. So, maraming salamat, Doc Migo. At hindi na natin patatagalin pa, no? Magtutungo na tayo sa exciting part ng ating kapihan para ngayong araw. At iyon ay ang presentation ni Doc Migo. Doc Migo.
Okay, so again, good afternoon, everyone. I hope that our session this afternoon will, if not be very interesting, at least very enlightening, to shed light on how we in the Department of Health are trying to ensure that we are making Filipinos healthier. No? So first off, before we start, maybe as a quick reflection, or if you would want to even type in the chat box, how would you understand how we can promote health? No? Maybe answering it from the lens of as individual, personally, how do you promote health, or your conception of how DOH promotes health? So just to tickle the mind a little bit this afternoon, just to get a sense of how we understand how we can actually promote health. When we ask this question to a lot of our participants and our partners in the LGUs, even from our non-government organization partners, most of the time people will think that promoting health will be equivalent to education, to telling people what they need to know so that they are aware of health risks, health signs and symptoms when they need to seek consult, which is correct. We do promote health by educating people, raising awareness, doing our advocacy work. But our session for this afternoon hopes to shed light on the other ways that we in the Department of Health actually concretize health promotion. So when we go to the definition of health promotion, let's first take a step back and ground ourselves on the definition of health, which the WHO defines as that complete state of physical, mental, and social well-being, and not just the absence of disease. So hindi porket wala na akong sakit ay healthy na ako, because for me to be healthy, I need to have, or I need to be in that complete state of physical, mental, and social well-being. So when we talk about health promotion, this is what we're promoting, that definition of health. We're not just promoting that people do not get sick, but we're also promoting the state of complete physical, mental, and social well-being. So how we do that is we enable people to increase control over their own health and what affects it. So yung mga tao mismo, they are in control, they have the power to influence how their health will run in the future or in the longer term. And those factors which affect their health, they are also in control of. So we mentioned there are also factors which contribute to the health of a person, and we termed it as determinants. So health promotion largely acknowledges that there are factors outside or within our control that influence our health in the long run. And this is what we call the social determinants of health. So these social determinants of health, they are not typically within the realm of the health sector to be influencing or improving on, but if we want to really achieve the best health for every Filipino, it would be pointless to not take into consideration how other sectors and other factors in life contribute to our health. For example, we can't talk about having good health if we do not get or if we do not have good working conditions, which allow us to earn money to pay for health services that we will need to keep us healthy. We can't talk about health if we don't get good quality education starting early from life, which will increase our knowledge and awareness on certain information. No, so those are what we call the social determinants of health. They're conditions in which we are born in, we work in, we study in, and where we grow up in, which will influence our health outcomes in the longer term. And why is the conversation of social determinants of health important in health promotion? It's because the reality of life is that, we weren't born equally. Some people, especially in our country, people who were born in faraway places, in geographically isolated and disadvantaged areas, they were born in conditions which are not similar in how we were born in. No, parang we're very privileged. We're very blessed to be born in a big city near hospitals with a wide range of opportunities for us to improve our own health in the long run. But this isn't the same for people who were born in these very difficult areas. And for them, it's not their fault that they were born there. It's not their life mission, or it shouldn't be their life mission to move out and go to a place where it's more easier or more enabling for them to live healthier lives. So from that context, health promotion and improving the social determinants of health makes it not only equal for every Filipino, but makes it equitable. So those people who have less in life should be getting more chunks of the pie, because as long as we keep on delivering equal levels of interventions or services, it won't really address the problems that we have in terms of health, because there are people being left behind. So that is the discussion on health promotion, that the root causes to why people get sick in the first place should be addressed and improved. And that is where we are taking a stake now in health promotion as part of universal healthcare. So all of this, health promotion, affecting or influencing social determinants of health, this is not something new. It was enshrined in the Ottawa Charter for Health Promotion, our quote-unquote Bible, when it comes to what we have to do to successfully implement health promotion programs. And as per the Ottawa Charter, it identified in this document, this global document, that there are 9 prerequisites to have optimum and maximum health in our communities. So that is peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity. And this highlights the social determinants of health, that if we're talking about health, health cannot occur if these basic things in our lives are not present. In addition, the Ottawa Charter also outlined 5 action areas and 3 strategies for successful health promotion. So we'll quickly go over them just to provide a context to what we do in health promotion. The 5 action areas are outlined in the slide, and the first is building healthy public policy. So health promotion occurs when we're able to put health in all policies at all sectors and at all levels, making sure that people are accountable, our decision makers are accountable to the health impacts of their own policies. So some examples of these are policies like no smoking within 100 meters of a school, our recent policy on the Joint Administrative Order on providing standards for green open public spaces, and our policies on eliminating trans fatty acids in food, through basic food production. The next is creating supportive environments. So in this action area, we focus on the environment of us as people, as individuals. And we sort of play the role where we're trying to modify the environment so that healthy behaviors are easier for people to do. So some examples of these are during the height of the pandemic, we were strong in advocating for protected bicycle lanes because it made it easier for people to live a healthy life because they were exercising. Before that, if you wanted to ride a bike to wherever you wanted to go, you felt unsafe because you were battling or sharing the road with four-wheeled vehicles, trucks, and it just didn't promote an environment where you wanted to be in that dangerous situation. So modifying the environment, dedicating protected bicycle lanes, that's a way of creating a supportive environment for promoting health. Another example is like in school canteens, instead of serving the full range of food that is available everywhere, like junk food, sugar sweetened beverages, we're just minimizing the food selection to healthy foods. So it's making it easier for the students to choose healthy, to live healthy, because that is the option that their environment provides them. So that's creating supportive environments. The next is strengthening community action. So this is like the heart of our process in health promotion, that it cannot be top down. It cannot be told to people what you need to do to promote your own health. The programs that we give cannot be dictated or provided in strict guidelines, but rather it should be co-created with the community, because we are creating solutions, creating programs for them. And if we continue to sit on our high thrones, then it will not really translate to programs which the community understands or needs or will be able to sustain in the longer run. So strengthening community action involves the community from the start, from planning all the way up to them carrying the program on their own, just assisting them on what are their actual needs and how we can put our expertise into helping them create their own programs for their own problems and their self-identified solution. The next is developing personal skills. So this is the way that we increase the knowledge and the skills of people to live healthier lives through education, our communication materials. We influence them to increase their awareness through advocacy campaigns by going into educational fora, sessions like this, increasing knowledge. That's developing personal skills. And lastly, reorienting health services. So this is our action in the health sector that predominantly we have been focused on improving the quality of health services, making sure that when Filipinos get sick, there is a healthcare worker there to be able to take care of them. The medicines are there, it's complete, it's of good quality, it's accessible. But reorienting health services for more health promotion will involve a lot of paradigm shifts and structural changes to ensure dedicated people who can focus on health promotion, because our current healthcare workers are already overloaded with therapeutic and clinical services. And that's the way that we can tip the scales from the therapeutic side to improving health more towards the promotive and preventive aspects to ensuring healthy Filipinos. And all of this is aligned with how universal healthcare aims to improve the health of every Filipino, to protect every Filipino from financial risk, meaning that when we have to pay for services, it won't put us into a state of poverty, and that our services are truly responsive to the needs of everyone in the country, that we do not continuously provide services which are not addressing the causes to why Filipinos get sick in the first place. No? So that's adopting being responsive to how we deliver our health services. And I just wanted to point out that as individuals, part of the paradigm shift involves understanding that only 20% of our health as people are affected by the health services that we get on a day-to-day basis. It's such a large minority, but the challenges in the past few years before universal healthcare was that we were focused on improving the delivery of health services. But now we're trying to push the envelope so that the other factors, the more impactful qualities which affect our health are being addressed by the health sector. 30% of what affects our health in the longer run is our day-to-day behaviors, whether we smoke, whether we exercise, eat healthy foods, practice safe sex. 10% comes from our environments. 40% comes from what we call the social determinants of health. If we had good education, good sources of income, and support from our social circles. So now, with our shifts in the health sector strategy, we're continuing our work to take care of Filipinos when needed. That's our bread and butter, improving the health services, making sure it's continuously being accessed and of good quality and affordable. But now we're also trying to improve and expand, addressing the causes to why Filipinos get sick. And this will involve a lot of multisectoral work to ensure that we're protecting and enabling Filipinos to care for themselves and the community. So in another way of describing it, let's say that I'm a student in school. If me as a student, you wanted me to not smoke, let's say, for example, if you wanted me to not smoke, do you think it would be enough for me to know that smoking is bad for me to be able to stop smoking? So that's not the case, no? Because if I wanted to not smoke anymore, but my friends continued to smoke around me, even if I knew it was bad, I think it would still be difficult for me to stop smoking because my friends still continue to smoke. And let's say, for example, that even if my friends were supporting me to stop smoking and I knew it was bad, but from an early age, it was inculcated in me that smoking was okay, that I was being encouraged to smoke at a very young age, then I don't think it would also be helpful for me to stop smoking as a student. So those are characteristics of people that we're trying to influence and create positive change in. And similarly, as a student, going back to that example, if okay, I knew what I needed to do. My friends were supportive. My upbringing, my culture promoted not smoking. But if I step outside my school, there's like a sari-sari store which sells cigarettes at a cheap price. It also wouldn't be easy for me to stop smoking. So those are characteristics of places. And to influence positive, healthy behaviors, it's about not just the individual knowledge, but also the social circles we have, the culture, and the characteristics of the places that we live, work, and grow in. And that is what we're trying to do in health promotion, putting in interventions at all levels to influence healthy behaviors. And in the Universal Healthcare Law, this was what was stipulated, that DOH would scale up health promotion by increasing health literacy and promoting programs and activities across the social determinants of health. And this is very much aligned with how we in the DOH are being strategic about improving the lives of every Filipino, which serves as our health sector strategy for the next 5 years. So our vision that Filipinos are the healthiest in Asia by 2040, and we have 4 strategic thrusts which correspond to 9 strategic objectives. So what I just want to highlight that in our 4 strategic thrusts, 1 is enabling Filipinos to be healthy. 2 is protecting them from health risks. 3 is caring for the health and wellness of every Filipino. And then 4 is strengthening our health institutions and workforce. 1 strategic thrust corresponds to our work in health promotion by improving the literacy and making sure that Filipinos have good health-seeking behavior, and that our settings, our communities, our workplaces, our schools are supportive of healthy behaviors. But health promotion just doesn't contribute to this, to these strategic objectives alone. We also contribute to managing disease outbreaks and preventing them from occurring through increasing health literacy and also healthy settings. Also, we're trying to right-size our government institutions so that we're ensuring and guaranteeing that there are people who are capable of promoting health well. They're equipped with the knowledge and skills of successful health promotion, and that our healthcare workers are given opportunities for professional development in healthy working environments. So that's ensuring that our workplaces are healthy so that our healthcare workers can do their job caring for our carers. So that's how we fit in to the medium-term plan of the Department of Health. And with that, we've released, as per the Universal Healthcare Law, the Health Promotion Framework Strategy, which is our 10-year roadmap for health promotion to guide all health promotion implementers, from LGUs to NGOs to civil society and even to national government. So in the Health Promotion Framework Strategy, we just have 3 objectives. 1 is that all Filipinos are health literate. 2, all settings are health enabling. And then 3, all public policies are supportive and protective of health. We're envisioning a healthy Pilipinas where, in short, we want to make healthy behaviors the easier choice for everyone, every time, and everywhere. So I'll expound on our mission of making it easier for people to live healthy every time and everywhere. So this is the HPFS, the Health Promotion Framework Strategy. I'll run through it quickly with everyone, starting with the action areas. So we already touched on this, that for health promotion to be done effectively, there are 5 actions as recommended by the WHO to do by our health promotion implementing agency. So looking into developing healthy public policies, creating supportive environments, developing personal skills, strengthening community action, and reorienting our health services. The next is what we will focus on. So we've trimmed down the causes of why Filipinos get sick and die into behavioral risk factors. So when we talk about the main causes to why Filipinos get sick, they can all be boiled down to 7 behaviors that we need to do constantly on a day-to-day basis to support our improvement in health. So it's about diet and exercise, eating right, moving more, environmental health, being clean, living sustainably. It's also about immunization, getting vaccinated, about substance use, not smoking, saying no to drugs, and not drinking. Mental health, it's caring for ourselves and caring for others. Sexual and reproductive health, it's about practicing safe sex. And then violence and injury prevention, it's doing no harm and putting our safety first. So all of these priority areas, they're boiled down into 7 key behaviors that we hope every Filipino will practice and translate into better health outcomes, addressing the primary causes to why we get sick and die as Filipinos. And the implementation approach will be through a life stage and settings-based approach. So in the life course approach, we're consolidating all the basic healthcare services across each critical life stage so that, for example, me as an adult, these are the critical life health services that I need to get for me to be able to transition well into older adulthood. So we're creating packages of interventions, basic health services, and policies and guidelines which will ensure that we comprehensively get the services that will make us healthy in our life stage and help us move across to the next life stage. And the settings-based approach is addressing and putting in our programs and interventions to the places where we spend most of our time in as Filipinos. So this makes, again, our mission of making healthy choices the easier choice for everyone because it's considered for each life stage, every time and everywhere through our settings-based approach. Na being healthy is not just a factor as to whether we're able to step into a health facility or not, but as soon as we step outside of our house, into our schools, into our workplaces, it's easier for us to live a healthy life. So that's how we try to picture our mission of a healthy Pilipinas. So that's the HPFS 2030, from what we're going to do to what we're going to focus on, how it will be implemented, and hopefully achieving the vision where people have better health by making it easier for people to live healthier lives. And in the HPFS, for the purpose of our discussion this afternoon, we do have 3 strategies, but we will focus specifically on healthy settings because this is even for our stakeholders, for our local implementers, this is relatively new. That's something that they needed a lot of guidance on, how to ensure that our places are healthy, or creating healthy settings. So again, as mentioned, we have three settings that we're trying to create as healthy to make it enabling for Filipinos to practice healthy behaviors, to make it easier for them. And this is where we spend most of our time in our communities, our schools, and our workplaces. So we'll start first with healthy communities. We define a healthy community through the DOH National Policy Framework on the Promotion and Recognition of Healthy Communities as any local government unit wherein not only are healthcare services accessible. I'll go straight into the second definition. So a healthy community is one where the health services are of good quality, they're accessible, they're affordable for every Filipino. But it's also about the physical, social, political, and economic factors which make up the environment, and they're actually protective and promotive of health. So a healthy community, more than having services available, affordable, and accessible, is that there is it's a community where you're guaranteeing that potable water is there. There is food security. There's green and open public spaces. There's good quality of housing and shelter and good quality education. The environment is clean and sustainable. There are mechanisms for income and support, especially among the more vulnerable members of the population. It promotes cultural heritage. It's substance abuse free, and it's safe, violence free, and inclusive. So we're trying to shift the paradigm again, that ensuring that our communities are healthy are not just about strengthening the healthcare services that we're providing, but also ensuring that the basic causes to why we get sick or the social determinants of health are being addressed by our local government units. So how this has been implemented throughout the past years that we have been established as a bureau. In 2021, we started with 7 provinces and citywide health systems and providing them support and tools through what we call the health promotion playbooks on how they can create healthy communities. So our playbooks, they are all-in-one guides for LGUs, starting from basic resource requirements, implementation plans, communication plans, even template policies on how they can create effective health promotion programs which will correspond to a priority area in the HPFS. In 2021, we started with 7 LGUs. Last year, we supported an additional 32. And this year, we're about to support 44 more LGUs. So in total, we have 83 provinces and citywide health systems who are implementing at least one health promotion playbook module for a healthy community. So I'll go deeper into each health promotion playbook. The first is for our priority area on diet and physical activity, the playbook on active transport. So this supports LGUs in providing them the tools and the templates for their own localization on how they can establish protected bicycle lanes, basically, for them to promote the behavior of exercising and bicycling from anywhere in their LGU. So we've done this in multiple LGUs. The pictures here are shown in Cordova, Cebu. The next playbook module that we have is transforming our karinderya into a healthy food hub, the Karinderya para sa Healthy Pilipinas. So it's empowering our local karinderyas to be nutritious food service providers, not only for beneficiaries to supplementary feeding programs among our malnourished children, but also to the community if they're equipped with skills and knowledge on how they can prepare safe and nutritious food. It will not only benefit the malnourished children, but the food that they cook on a day-to-day basis. And it teaches the LGU how they can mobilize and support their karinderyas to be able to be champions of nutrition in their own community. So the pictures here are shown in Albay. The next playbook module we have on environmental health is how we can encourage the behavior of hand washing, so that I think the research tells us that most of the time we know that hand washing is the best for us, but we more often than not forget to do it. So the behavioral nudges for hand hygiene helps teach LGUs on how to promote the behavior of hand washing by making it salient and nudging people to wash their hands during critical moments of the day. So we use nudge theory, a principle of behavioral economics, to get people to wash their hands subliminally through very subtle cues that will remind you, to wash your hands during these critical moments. For our priority area on immunization, we have the playbook module on Bakuna Champions. So this strengthens the skills and mobilizes our barangay health workers as the main influencers to encourage vaccination in the community. So we build the skills of barangay health workers. We provide them templates so that it can make it more enticing for BHWs to lobby and advocate for immunization in their community. And it's a personal development program for our barangay health workers, accompanied by incentives that the LGUs can provide and identify on their own how they can address vaccine hesitancy in the community. So the pictures here are shown in Biliran. The next playbook for substance use is creating smoke and vape-free communities. So this playbook module teaches LGUs on how they can create safe environments, safe spaces, safe physical spaces, which will guarantee that people are protected from the harms of not only smoking, but taking in secondhand smoke. So it abides and localizes the WHO Empower strategy for communities to adopt and localize based on their own context. For mental health, we have a playbook module on creating peer support groups for the youth. So it transforms the community, makes it more accessible for the youth to access age-appropriate resources to help them overcome the difficulties and the issues that they face, which will contribute to their mental health in the long run. So we're empowering, mobilizing these youth-led peer support groups through the LGU and equipping them with skills and knowledge on how they can manage their own small peer support groups and provide support to each other. So the LGU just supports and enables the support groups, but it's led by the youth themselves. So this playbook is the pictures here are shown in Misamis Oriental and Batanes. Our playbook module on sexual and reproductive health is the CADA network. So we're expanding or creating more adolescent-friendly health services through skills development of our LGU offices to provide responsive and adolescent-friendly services so that the youth feel like the people who are providing these basic services that the youth need are their friends, their allies, and they can go to them whenever they will need something that they are experiencing difficulty in this critical life stage. So we mobilize and organize the local government unit to identify who we need to equip on skills to provide and make our services more adolescent friendly. And then lastly, for violence and injury prevention, this addresses the experience of violence against women and children because the most common perpetrator that these victims of abuse will have are the people that they live with at home. So ensuring and guaranteeing a healthy community means making the information that these victims of abuse need reach their homes. And this is through, again, mobilizing barangay health workers to be able to equip them with knowledge and skills on how they can provide education and information to what is violence when it is occurring and what they can do to seek help and what are the mechanisms available in the local government unit to protect them. So we're bringing the information to the level of the household by mobilizing our barangay health workers as health promotion officers at the barangay level. And we're developing more playbooks which are aligned with the Healthy Communities Framework in the next few years. The next setting is healthy schools. So for healthy schools, this is critical because we cannot have a healthy community if our schools are not healthy. So as per the DOH DepEd test that shed learning Legal Education Board, DILG, and DSWD guidelines on the healthy settings framework in learning institutions. A healthy school is defined as one that ensures that the next generation of Filipino learners not only graduate from school with more knowledge, but also better health. And this involves not only teaching them the right knowledge and skills that they need to know within the school, but guaranteeing that the school itself enables and promotes health through the environment. So the interventions that we have for creating healthy learning institutions focus also on modifying the school environment, like the physical environment, the social school environment, which hopes to address problems brought about by bullying to the mental health of students. It also seeks to link the school with the community so that it's seamless. What the students learn from school are also translated to what the parents and their families will support them when they go back home, and also ensuring that the healthcare services are available in the school. So in the past years, we started with 9 provinces and cities, empowering them and strengthening their skills on how to implement the HLI framework in their own province, which contributed or corresponded to 273 last mile elementary schools. In this coming year, we're focusing to expand and provide support to 21 more provinces and cities. So a total of 30 provinces and cities will be implementing the HLI program together with DepEd in 900 schools nationwide. So what we do and empower at the side of the DOH is that we provide technical and financial assistance to our LGU for the activities required for healthy learning institutions, and we enable the partnerships between our regional DepEd counterparts and the local health offices. So that's where our support went into for the past few years. The next and last work setting is workplaces. So right now it's still a draft, but we already have a ongoing policy work with DOLE and Civil Service Commission on the National Policy Framework for the promotion of healthy workplaces. And this draft policy defines a workplace in which the workers and managers collaborate to use continual improvement processes to protect and promote worker health, safety, and well-being, and the sustainability of the workplace. So similarly, like other settings, it's also more than just the health services that are available in the setting, but also the physical work conditions, the psychosocial environment, and how it's linked with the community. As a jumpstart to the healthy workplace work, since 2020, during the height of the pandemic, there was an urgent need to make our hospitals healthy because we needed to care for our carers who were caring for the rest of the population. And our healthcare workers experienced so much stress during the pandemic. So we put in interventions to create healthy hospitals for our healthcare workers. We use the science of behavioral design to create interventions and tools which tailor fit specific behaviors to the context of the healthcare worker. So we develop tools and nudges for them during critical times of their day as a healthcare worker for them to practice better mental health promotion behavior. So before they came into work, we hope that they would take a deep breath first, be able to ground themselves. So we developed tools for this, like text message blasts and deep breathing meditation guides, which as a nudge, we instructed them to place them near areas or anchor them on moments where they would remember to do it. During duty, we wanted healthcare workers to, feel more relaxed during the waxing and waning stress levels that they would experience during their duty. So we provided them tools like stress balls and scented stickers, which are evidence-based to really decrease the stress that healthcare workers could experience during their line of duty. And post-duty, since healthcare workers, during the end of their duty, they would tend to ruminate on the negative highlights of the day. The nudges and interventions that we had were for them to be grateful for the positive things that transpired that day. And lastly, critical to ensuring the wellness of our healthcare workers was the support that they were receiving from their supervisor. So we also had tools for this, to prompt supervisors to check in on their teammates so that they felt supported. And in our study, it significantly increased positive affect and improvement in wellness scores using validated psychological scales. So right now, we're scaling this up. We've already implemented it in 26 hospitals, benefiting around 1,000 plus healthcare workers, 1,500 plus healthcare workers. And later on this year, we hope to reach an additional 100 hospitals, which will be an equivalent of 3,000 healthcare workers. So that's our initial work in healthy workplaces. And a lot has been said in the work for health promotion. That was just one aspect of it, healthy settings. But similarly, even with the other strategies, we're putting in our support to our implementers, building their capacity, providing technical and financial assistance, building the skills of the local health promotion implementers to achieve the outputs of universal healthcare, which basically organizes our healthcare system into population-based and individual-based healthcare services, so that regardless of where you are or where you live as a Filipino, even if there's no big hospital put up in your island, you are guaranteed that you can get that full range of services because our services are organized through healthcare provider networks. And in effect, through the strengthening of population-based health services, we're creating healthy people in healthy places because that's the focus of health promotion. We're not just increasing the literacy of people for their capacity to understand what they need to do to live healthier lives, but making our settings more enabling and supportive for Filipinos to live healthier lives. And in effect, we're influencing positive behavior change, aligned with the 7 behaviors that we want every Filipino to do. So imagine on a baseline, if every Filipino consumes healthy diets, it will reduce the number of mortality from non-communicable diseases like hypertension, diabetes, stroke. Even the same with physical activity. If more Filipinos exercise, the same will happen. Even lesser morbidity from malnutrition. If every Filipino practices a sustainable lifestyle, it will reduce the number of individuals affected by climate-related disasters. Improved sanitation will reduce our exposure to environmental risks like the food-borne diseases. Improved disaster preparedness will also influence reduction in mental health disorders. Getting fully immunized reduces vaccine-preventable diseases. Avoiding smoking, alcohol use, and drug use also significantly decreases non-communicable diseases and cancer, as well as even mental health disorders and road traffic injuries as well. Practicing self-care reduces mental health disorders, the incidence of suicide. Practicing safe sex reduces sexually transmitted infections and early unwanted pregnancies. And avoiding dangerous and violent behavior also reduces the number of people who suffer from interpersonal violence, like are victims of abuse, occupational hazards, and road traffic injuries. So that's how we're envisioning behaviors to be so critical to how we are reducing the major causes of why Filipinos get sick and die in the first place. And again, it's because not only are they knowledgeable that they need to do these healthy behaviors, but because the settings that we're in make it easier for people to do these healthy behaviors. And that's an offshoot of how universal healthcare hopes to achieve this. And that is why we're continuing to provide our support to everyone so that in the long run, it's a healthy Pilipinas. So with that, that ends the presentation on healthy settings, so we can take some questions from our partners if you would have clarifications.
Ayan, thank you very much, Doc Migo. Talagang napakasiksik at talagang umaapaw ang naging discussion sa Healthy Pilipinas, sa healthy settings, at kung paano natin magagawang healthy ang ating mga pamayanan, paaralan, at workplaces para sa bawat wana-wana. So upang masagot ang ating mga katanungan, muli, Doc Migo, here's the first question po. From a regular media partner, and I think this ties itself in promoting healthy settings, the question from Rafael Bosano ng ABS-CBN News, kung sakaling mag-decide ang World Health Organization na i-lift ang public health emergency of international concern status ng COVID, ano pa rin ang nakikita ninyong dapat manatili sa mga community, schools, and workplaces para manatiling mababa ang bilang ng mga nagkakasakit?
Yeah, no, so parang thank you, Sir Rafael, for the question. I think what it's not what remains with the LGU, sakaling malift yung state of public health emergency. It's how we should move forward in our communities, which should change and adopt this paradigm shift. Na more than being responsive, putting in the services that we're able to address and mitigate the effects of the pandemic in our communities, if we're adopting the framework and ensuring that the baseline or the root causes to why COVID blew up in our communities are addressed, then that's where the healthy communities framework comes in. If we're looking into specifically the pandemic, no, parang it's ensuring that the reasons to why the pandemic was spreading are contained. And for example, if we're talking about people not wearing masks, this would translate into people having more sources of income to be able to afford their personal protective equipment, diba? If we're talking about the lack of physical distancing in the communities, this will be translated into ensuring that the quality of housing allows for the practice of physical distancing in each and every household. If we're talking about knowing the right information, parang being able to differentiate fake news from accurate news, this will be about ensuring that in our communities there's good quality education so that people know how to filter out what is fake from the real information. No? So that's what we need to guarantee, more than providing those responsive services which can lessen the prevalence or mitigate the effects of the pandemic. It's ensuring that baseline, these basic things that we need for us to live healthier lives are present. And that's how we hope to transform our communities moving forward, no, from the pandemic.
Ayan. Thank you, Doc Migo. Ang follow-up question po mula kay Sir Rafael Bosano. So nakikita na ba natin sa communities na muscle memory na ang pagpapanatili ng safety and health? Ano pa po ba sa tingin niyo yung mga bagay na kailangan pa ng improvement para manatiling healthy ang ating mga community?
Yeah, I think in terms of the pandemic, I think we've more or less inculcated the behaviors that people need to do. This is also shown in our surveys, no, which assess the literacy of people when it comes to the basic risk factors to why COVID is spreading in the community. But then again, I partially answered this a while ago. What needs to be improved are the baseline factors to help people make these healthy decisions easier, and they need to be present in the community and supported by our local decision makers. No?
Ayan, thank you, Doc. So para po sa ating next question, how does healthy settings tie up with the universal healthcare? And are we already seeing or implementing these in key areas like public spaces and schools, among others? And follow-up question po dun, Doc. In relation to this, do we have metrics on assessing the effectiveness of healthy setting strategies for communities?
Yes, so I think I answered I tackled a little bit of the first question, how it ties into universal healthcare. We're scaling up health promotion, and health promotion is more than just increasing individual knowledge, but also making places healthy so that healthy behaviors are easier for people to do. The second question on what are the metrics, so that's ongoing work at the national level. We're about to convene our national technical working groups to create standards and goals and objectives for our LGUs, which correspond to the characteristics of a healthy community and a healthy school, so that this will serve as their their guide in achieving the specific standard or the specific quality of the healthy setting. So while we're still developing that, it will be translated into a tangible number that we can get sources of data from our local implementers, and from those standards and indicators that are to be determined, we'll be able to assess throughout the years of implementation the impact on how making our settings healthy will influence positive health outcomes. So I showed that change na by guaranteeing that our settings are healthy, it will increase positive behavior change and hopefully reduce the negative health outcomes that we experience as Filipinos. No?
And thank you, Doc. So hopefully after ma-develop siya, ma-invite namin kayo ulit para ma-discuss namin and ma-update din kami about it. So Doc, we're down to our last two questions po no, for this afternoon. For our next question, Doc, on an individual level, how do we contribute to practicing healthy settings, and what can we do in terms of health promotion and help alleviate the social determinants of health?
That's a really nice question. No? At an individual level, it's really about increasing our health literacy. So if we are knowledgeable ourselves about those factors which contribute to our health, what is healthy, what is not, then we contribute to healthy settings by lobbying and advocating for our settings to be healthy, because we know that it's not enough for us to know the right knowledge alone, but it's also a large proportion of guaranteeing that our settings are also healthy. So at an individual level, that's something it's not a privilege, it's not something that, oh, it's nice to have, but something that we should be demanding for. And our work in the government puts in the standards, puts in the regulation, pero at an individual level, that's where strengthening community action for health promotion comes in. That these are self-identified by individuals, by communities, so that government listens and is able to provide the interventions which the people are trying to raise up and voice out. No, so that's at an individual level how we can contribute to healthy settings, push for it, demand for it, and make sure that the people overseeing our settings to transform them as healthy are accountable to that. No, so that's how we can do it as individuals.
And thank you, Doc Migo. Talagang nai-highlight kung paano may ambag ang bawat isa sa atin no sa pagbabago, kung paano natin mas mai-improve at mas magagawang healthy ang ating communities. So Doc, para sa ating last question po, how do we access itong mga playbook na ito which outline implementation guidelines of healthy settings, and is this available also for private sectors since LGUs are the primary focus of these guidebooks?
Yes, so they're available on healthypilipinas.ph. It's our health promotion website in the Department of Health. They're free for download for anyone. So we primarily target LGUs, but even NGOs, civil society, they use our playbooks in tandem with LGUs so that they can establish these evidence-based and effective health promotion programs. So it's free for anyone to use. We provide technical assistance on whether you would need more support for implementing any of these modules, and we'd be happy to help anyone who would ask or need for help.
Ayan. So, hopefully na-take down po ng ating mga media partners ang binanggit na link ni Doc Migo kung saan makukuha ang ating mga guidebooks para sa healthy settings. So Doc, bago po tayo tuluyang maghiwa-hiwalay, ang inyo pong takeaway messages para sa ating mga tagapanood ngayong araw.
Okay. Takeaway message lang is that I hope you can be one with us, no? That this mission of creating a healthy Pilipinas is not something that we can do alone in the health sector. We're trying to transform the work that we do, shifting away from just improving healthcare services to guaranteeing involvement of everyone, every government agency, every person, every sector into aligning for a healthier Pilipinas. So you guys play an important role also, especially in the media, by providing accurate information and reliable information. So we hope that you continue to be our partners in this mission. And, healthy behaviors will not occur if not only the knowledge is good, but also our settings are enabling also. So yun, I hope that's the key takeaway from our afternoon.
Ayan. So muli maraming salamat, Doc Migo. At nabigyan ninyo kami ng sapat na impormasyon on what is healthy and what is not, and kung paano pa natin mas gagawing healthy not only ourselves but also our communities. Nagpapasalamat din po kami sa ating mga media partners sa patuloy na pagiging katuwang sa pagpapakalap ng tama at napapanahong impormasyong pangkalusugan. Kagaya nga ng sabi ni Doc Migo, hindi po magiging posible ang healthy Pilipinas kung dahil lang sa kagawaran ng kalusugan. Kaya hinihikayat po namin ng bawat isa na lumahok sa ating mga programa para rito. Kung idudugtong din natin ang sinabi ni Doc Migo kanina, patuloy nating isusulong ang qualities na makakaapekto sa ating health sector sa pamamagitan ng pag-promote ng healthy settings at pag-practice ng healthy behaviors sa ngalan ng universal healthcare. Muli, isang huwana mula sa Kagawaran ng Kalusugan. Ako po si Nikki Nesasario at magkita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po, Doc Migo.
Thank you. Ingat po.